most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the 12 rules for massaging away knots, muscle strains, or tendonitis. Basically, anytime you need to massage, these are the rules.
Even dozen, and we're talking about some manual and even
Yes,
some
we'll
gun
talk
massage.
about that. We'll
Yep.
mention that. So
Okay.
let's first talk about knots, Brad, because those are kind of a world of their own. We're talking about trigger points.
Right, not a bowling knot.
No, not
a knot with a
right.
rope.
Not a tie knot, no. So the trigger point therapy workbook called the knots, they define it as a grumpy little spot in a taut band, a tight band of muscle tissue that hurts when you press on it and may reproduce your pain symptoms.
So same as a trigger point.
Yeah, same as a trigger point. The thing about knots, and Brad, I think you'll agree with this, they really don't know what causes them. And they really don't understand them to a large extent.
Yeah, I got theories.
But these are the rules, according to the workbook, of how you want to manage these knots.
Right.
So,
I think the good news is you can manage.
yes, exactly. So, number one, never massage a pulse. If there's some arteries near the surface, like you want to go along the carotid artery here, you want to massage that, especially when you're using a tool. I mean, because you can really leverage it then.
Yeah.
So, and number two is use a tool whenever possible, because you're going to save your hands. I don't know how massage therapists do it, Brad. I really don't.
Well, I
because
think a lot of them must use tools.
I think they do in their elbows and stuff like that. But
Right.
some of the tools are like the TheraCane or a cane like this, a massage cane.
Sure.
You can use the lacrosse ball. Brad and I kind of like this little spiky ball.
Yeah. Plus it lights up.
Yeah, how fun is that?
Yeah. They're cheap too.
The massage guns, we got a whole variety of them. They work really quite well because they percuss at the same time you can pressure on and you don't become tired.
And they have different heads, 5 different heads.
Right.
So there's very
Different
versatile.
attachments.
They're wonderful.
All right, so I just talked about the tools. Now, whenever possible, you're supposed to use deep stroking. So get deep down in if you're going to try to get rid of that knot.
And that's why you don't want to go over a pulse. You want
Right.
to go over muscle, belly. Bob mentioned the pulse here. Maybe, obviously in the wrist there's a pulse. There's a pulse that's in the crux of your elbow here. So if do you think there's a pulse there? You could feel it.
Yeah,
you
you
be
could
real
feel it.
quiet and then
Right.
stay away from that area.
So you're supposed to do deep strokes, but you're supposed to do repeated short strokes. So you're kind of staying in the area of the knot. So if there's a knot right here, and I'm massaging it, I'm not going across like this. I'm staying right on the knot, deep, and I'm doing short strokes. Also, the next one is actually in the same direction. You want to go. You don't want to go this way, this way. They just say ergonomically. I'm not sure the reason for that, Brad, but you're supposed to stay in the same direction.
So that's a little different than the cross fiber, the Syriax cross fiber.
Right.
Okay.
I don't know. Is it? Because we're going
We
one
want to go
direction
across
too.
the fiber, though.
Yeah, which you can do here too.
Oh, I see what you're
Just
saying.
one direction. You're supposed to pick
I
one direction and
understand.
stick with it. So the pain should be a good pain. You don't want to have, if on a scale of 1 to 10, you're getting over a 5, that's probably too much. But you know how it is when something feels like it hurts so good.
Right.
That's what it should feel like. You're doing something good.
And that rule of thumb, you'll find that knot that it'll be like my teacher of mine said like a Tootsie Roll. It's kind of like the size of them. There's that knot, and it's tender. But when you start massaging it after 20 or 30 seconds, it should start to feel better.
Exactly. You want to see the pain levels go down a couple notches.
Right. And some people, report, and I've had this experience myself, where it kind of feels like a numbish feeling.
Yes.
That's another positive sign. If it feels like it's tender, it's making you squint, then it's no good. We don't want sharp pain.
The strokes should be done slowly. They want you going back slowly, back and forth. They are recommending 10 to 12 strokes per knot. And so that's not that many. But then you're supposed to do it throughout the day 3 to 6 times.
Okay.
So you're going to have your tools ready for, carry them with you. let's see. If there's no relief, that's the final rule. You're probably on the wrong spot.
Sure.
That's what they're saying. So,
Okay.
but otherwise, if you do it 3 to 6 times a day and it's feeling like if you're following the rules like we say, hopefully that knot's going to get better. So now, what if you are having trouble with like a muscle strain or tendonitis? In that case, we're going to do more like cross fiber friction massage, developed by Syriax and Dr. Syriax, who is the father of orthopedic medicine. So James Syriax, right? Yeah.
James.
Yeah. So if you're, let's say, on a muscle belly or on a tendon, it's really kind of the same thing. I want you to you can put your fingers side by side or one finger right on top of each other, and you're going to find the tender spot, and you go across the fibers. The fibers run this way, but you're going to go across the fibers, whether it's a tendon or whether it's a muscle.
Yeah, if it was in your calf, the fibers go this way. And so we're just going to work that.
Yeah, you're using your thumb there, aren't you?
Well, yeah, actually on my calf, it's hard to get my fingers this way.
Right. And that's what we talk about. Sometimes that's where a gun comes in handy.
Right,
So
yep.
I'm actually going to have Brad show the gun here in just a little bit.
Sure, you bet.
Because how you use it for cross fiber. So you try for 30 to 60 seconds, and if the pain just keeps getting worse, it's too tender to begin this. So if it does plateau, gets numb, or gets better, you can keep going.
And, maybe we could just say, the difference between a knot is where a muscle just tightens up. But Bob had mentioned, if it's actually a tear, a micro tear, a small tear, then it's different because the tissue actually has micro tears, and it may not up as a result of that or get tight, or it's just painful as a result. But then you're trying to break up scar tissue versus just release the knot.
And get more blood flow to the area.
Yeah.
So
And those two can be confusing if you're not really familiar with it. But
kind of as a general rule of thumb, if the pain is spreading out, it's getting worse. If it's concentrating and getting more
into one
focused,
spot,
centralization, Mackenzie calls it, it's getting better. So if what you're doing is spreading out more, it's probably getting worse. And
Sure.
You're going to try something else for a while
Yep.
and then come back to it. Or you might massage the muscles around it.
Right.
And then focus on that. So, Brad, do you want to just show the massage gun, how you use it across fiber on a tendon?
Sure. Yep. So again, like with this gun, this is one of our smaller ones, but it really it's a great one for size. We got two of them, but you can see now this is reciprocating this way.
Right.
Okay. So let's say I was doing let's say I had tendonitis on my
infrapatella.
Yep. So I'm not going to take it and go right in like that. You can see that would be
just bounces
painful.
along, and it's not going to help.
You're just going to make things worse. I'm going to go sideways because the fibers of the tendon go vertical in this point, and we're just going to work it this way. And you can vary the angle a little bit, and it
Now, the
works
thing
quite
about
well.
this, why a massage gun is good for this, because James Syriax, if you follow his recommendations, for many of these things, he recommends 15 to 20 minutes of massage.
Yeah.
Now, we tell people to break it up, throughout the day. But even 5 minutes of massage with your hands is very difficult.
Yeah, if I'm doing this, you get a sore thumb.
Yeah, you're going to be having your thumb treated then too.
Especially if you're, a little older and you got some arthritic joints in your hands or fingers, then it's even worse.
Or especially if you're younger and you text a lot.
Yeah. But you can see I put my leg down so I can let the muscle relax, and I'm going to have a better result. There's 5 different levels of intensity on this, so you can work with that as
and
well.
different heads, like we mentioned already. Like if you wanted to get one that was more of there's a pointer one. But I have to give Brad credit. Maybe somebody else has also come up with this, but he's the first guy I know that came up with that cross fiber that way, going across that way instead of going like this.
Oh.
And going. I mean, maybe somebody else has done it. But
No, I'm sure not. No, if I thought of it, I'm sure many other people have.
He's a genius. So, all right. This video is a part of a series of videos on massage. If you want to see the entire series, go to bobandbrad.com. Go to the programs section. We have a whole bunch of programs there. If you have some problems, go check it out. And under the program section, you find the one on massage. And watch the videos that just pertain to you.
Right, you can scroll through the videos. They're all in one spot. Look at the title of the video. It'll be self-explanatory if it's what you want. And the beauty of these are there's a PDF printout that you print out a review and how to do the whatever information is on the video. And the next beauty is it's all free.
It's free, baby.
Not even an email is asked. So
We'll ask for your oldest child. And
why, Bob? That deserves a why, Bob. Why?
That's all right. Thanks for watching.